say about Tower Hamlets is that it has a whole load of quite worrying numbers. So, highest infant mortality, second highest case, et cetera, et cetera. You can read that. So it's a in a London community that on the data experiences an awful lot of challenge. It's not unusual for London. I mean, it's an end of it, but we know that this is what so much of our city looks like. That people experience very high levels of poverty, and that leads to all these other things. But we need to know that, and we need to understand that, and we need to recognise that's why we're there. But actually, our experience is people like Ina. Ina is one of the volunteers who works on community driving change. She's working with us now. She'll work with whoever rocks up, I reckon. Whoever rocks up and says, I've got some ideas, I've got some resources, what should we do? Ina will turn up to the meetings and she will do it. But Ina lives in a 2-bedroom flat in social housing. She has 5 children and her husband. They've been on a waiting list to be moved for 6 years. And her children are growing in this very overcrowded, cramped space. She is a doer. She is really well connected. But the health outcomes, statistically, the health outcomes for Ina and her family are not great. And so, and she has an insight into that. She recognises that she's really recognised herself as a mother, and the power that gives her, and the opportunity that gives her to change these children's lives. And she also recognises herself as a key member of the community. She's well networked, and she knows that she has influence. She's aware of her own influence in that. And so I guess the thing to bear in mind when we think about those statistics is that underneath those statistics, there are thousands of people like Ina who are clearly, they're not naive to it. I mean, she knows that things are difficult. But her resilience and her determination and her energy for change is really inspiring. And I guess what our work is about saying, how do we enable people like Ina to influence the bigger change? So that to start off with, the things she's working on with us are quite small, but I really wanted to bring Ina with me today, but she had one of her children had an appointment she needed to go to. She had lined up to come. But so that's also the other reality of people like Ina's lives. They're juggling many things. They can't carve it out in quite the same way that we can clear out our diaries in a way that we could do today. So I want to tell you about communities driving change. So this is really, this is a really courageous thing that London Borough of Tower Hamlets have done. So they have said that they have turned some of their public health resource into saying, instead of delivering public health to people, how can we enable people to shape their own priorities for public health? How can public health in this community, in this city, in this borough, be driven by the people? We've been delivering services to these. The conversation we had when we started this a year ago, just over 18 months ago, was a recognition from the system there that they've been delivering health to the people of Tower Hamlets for a long time and are not seeing the change that they want to see. So what if we flip that and say to the people of Tower Hamlets, what's health mean to you? What does a good life mean to you? What's the change? What are the things that you value and want to do? What if we flipped it and did that? And that's what community driving change is. And so basically they've split the borough into these 4 quadrants, and we're working in one quadrant, and that's the partnership that are doing it. So it's the shifting the focus from engaging and involving to giving people leadership and more control. So big up to Tower Hamlets for having the courage to do this. And the officers that are doing that are really, they're having to fight it up the line. I deliver stuff to them, and I know that they're having to interpret that into the sort of data that you guys need in order to keep the system convinced that this is the right direction to have going. And it's gone well so far, but I'm always aware that for the champions to to make sure that the whole system keeps the courage over a journey of 4 or 5 years is, I think, challenging and difficult. And you know, I really recognise it. And you know, big up to Sir Hamlets. So when we went out, what the programme tries to do is this, you know, to have local people determine to identify what they want to do. And it's very much that it's their priorities, their issues, and then they design and deliver the interventions. So one of the easiest things to do is to go in there and people have some ideas and then for us to just do that. But what we've done is taken a little step back and said, we're not going to do it. We are going to bring people together and the community will lead it and drive it. So it takes a little bit longer, but obviously is much more sustainable and actually builds the capacity of people to carry on doing it. So, you know, capacity building is a really key part of this. And so this is that's the what, and this is the how. So we start by, we talk to people about what do you love about this? What's great here? What's working here? I really like the question earlier on this morning, you know, what gives you hope? The swimming pool picture came out of somebody, that question, which is a new question I might try and see if we can inject, because it's a really great question. But yeah, we say, what do you love? What is great? What's working? So you start from that. I mean, clearly people, you never get away from the fact that people are dealing with a lot of things that they don't love and a lot of things that are problematic. So it's not denying that, but starting with the positives. And then we use service design and all the kind of design thinking tools, and but do it in very accessible ways. The advantage with those tools is that they're very flexible, they're very hands-on. That it's not people sitting in meetings; it's people doing stuff. So that's much more engaging. And then we're trying to take that into the system piece, which is what I'm going to talk to you at the end. So one of the first things that came up was. When you ask people, we went out and talked to people about what mattered, what are the things that people are concerned about. The things that came back were things like the drugs and the crime on the estate, the fact that there's nothing for young people to do, not just do today in terms of youth services, which is a problem, but Hamlets has got a better youth offer than some London boroughs, but much more a worry that parents and families have about what are these kids going to do after this. What are they going to go on to do? Because they can see that the older, the people in their 20s and 30s now didn't have much of a chance. So if you've got a 14-year-old kid, you're really worried. Like, what's he going to do? And really, we can't community lead job opportunities very well on an estate like that. I mean, you can do a bit, but so it's really thinking about, so what do the young people think would really help them to get on in life? So the parents can't. Well, our hypothesis was that if in terms of opportunities for young people, let's go back and talk to the young people. What is it they want to do, and how do you get them to think about their futures? So we are now doing youth-led activities where young people are talking about what they want, and they want better careers advice. They want access to proper jobs. They're really aware, young people in Hamlets and everywhere else are really aware of the difference between a job and a proper job. They know what poor quality, low wage, jobs are like. They can see that around them. But they have a very clear idea of what a decent job is. So that's kind of a set of insights that I didn't know that 14, 15-year-olds had that kind of nuance of understanding what good jobs are. So really then talking with them about, okay, so what does that require? What does that need? And then setting up some activities that they can do. Some of them do involve football. I can't quite see the connection, but no, there is a football connection, because for one of them, the connection was that we got that the young people said they could only get other young people together if we organised it around sport. So there's some football activities and then some employment-related activities tagged on to the end. So that's what we're doing on that one. So the thing that, so these are some of the tools that we're using. So basically, how we get people to develop. So this idea that people come ready with ideas, they have things that they're already doing. But how do you get that to be a bit more ambitious? How do you get that? How do you drive ambition into it? And that we do by bringing examples from other places where people have done more. One of the things that the local community said they wanted was to have better access to local services, and they're feeling that there was a lot of stuff around there, but they weren't getting it. And one of the barriers was access to English. So we didn't start off saying these women need to learn English. It started off from them having an expressed desire to get better access, and then from that came a desire. So that means we need to have better access to English, and there is ESOL provision into Hamlets, but it was felt to be long. It was felt to be numerous barriers to getting onto it. So what happened was a group of 4 women set up a project called Flourishing Futures, which is that one, where they basically trained. They got some training themselves to become conversational English facilitators, and they are now running this Flourishing Futures group where they're teaching fellow parents English. Now, the reality is that an English language course is quite a long way from health outcomes if you're looking at it in a very kind of concrete way. So you do have to recognise that that's why the kind of broader social determinants thing is so important, that you have to keep remembering that until we help people to do the things that they care about and give them the platforms that they want, you can't go to solving the bigger health problems. So this project has had so many interesting outcomes. So they've been running it for maybe 7-8 months now. They meet in a local primary school. And that local primary school, when we first did the stakeholder engagement, the local primary school was very keen to improve services for the parents, realised that the parents weren't very involved in their children's learning, wanted to do more parental engagement, very much wanted to provide services for these parents, and really, in the kindest possible way, saw these parents as in need of services, that they were beneficiaries, and we, the school, need to do more for these parents. And what Flourishing Futures has happened, and what's happened through these ESOL classes, is that these women are now coming into the school as partners, as deliverers. They're not beneficiaries. They are people who are actually running something, leading a program in the school, helping the school to achieve some of its outcomes. But actually, for me, the biggest system change piece there is that we have changed the perception. The women have changed, have moved from being recipients of services, beneficiaries who need services, to being agents, actors. So now the school has got a set of partners that they can work with for a whole load of other things. It's how do we turn that kind of initiative into a broader system change piece, and how do we scale that, and how do we do more of that? For me, all the little initiatives that we're doing, and we're doing about 15 of them, some working on drugs, some working on young people, some working on more community cohesion activities, people coming together, events. I mean, just there's a whole load of plethora of activities going on, all led by local residents. But I keep saying it's about, but for me, the challenge is these are small initiatives, and they will only have power and be big if we can connect them to all of you and to people like you. So within Town Hamlets, we are doing this whole piece of work of trying to say, how can we connect, how can we use systems thinking approaches to really shift this? And so one of the things is, trying to unpack that system. So when we did it with the women, these are the things that emerged as the broader system, the broader systemic things that are preventing them from achieving the change they want to see. So this stuff about the education sector, they're feeling that the school was slightly patronising towards them. It wasn't a big deal, but it was a feeling that that the school didn't always respond to them and that they wanted to, that there were not enough employment jobs for the opportunities for them. They couldn't access it, and that's what they needed ESOL for. The reality of racism and Islamophobia and how that impacts them. The thing about gender, that this is mostly led by women, but trying to get the men involved. How do you do that, etc., etc. And so for us, the system change piece is to say that you have to look at you have to look at these issues in the round and pull in all those other things. So we're not going to unlock the capacity of these women by just giving them ESOL classes or just giving them or helping them to run any of these things. We are going to unlock it when we can get these other bits of the system also to work, to collaborate, to enable these women to have the life they want. So the questions that we're asking of the partners that we're working with is that thing about beneficiary to agent, beneficiary to actor, that piece. Then, how did the decisions get made about the resources in this for this issue? What are the things that are blocking? What are the enablers? And then how can we build a bigger picture about where we want this initiative to go? So if we want to do an ESOL activity that goes beyond just teaching 15 people English, if we want to use that as a broader lever to unlock how people can get access to jobs, how people can get access, how can we can deal with racism and Islamophobia in the community? How can that ESOL project achieve a much greater thing? These women cannot do it on their own. And so for me, the big thing, a lot of the work I do is around community-led change, and we get called in to do it with lots of organisations, and we do. And I repeat my point that communities have all this capacity, but I'm nervous that there's a danger that by talking about community-led change, what that says is that the responsibility for change lies with the community. That the system can take a step back and say we are going to give it over to the community. My classic one is the parks, and this is a separate story. But when in a moment of cuts in about 2014-15, a whole load of public parks around. I'm not so much in London, but in other parts were given over to communities. The council couldn't run them anymore. They gave them over to communities. They didn't really give them over to communities. They just handed them across and just kind of abandoned, because for good and understandable reasons. That isn't community-led change. You can only give a park over to a community if you know that community's got the resource and got the capacity and done all the work to able to run it. Just handing it over. So, that's my worry. So, and this is the conversation I'd really like to have with you. That, what we're doing as a delivery, in this little thing is we are measuring and tracking and capturing the individual change. So the individual people that we're working with. We're looking at what that impact has on the community, so we can measure things and gather things in a neighbourhood. But that, what we're really wanting to track is how does this connect to system change? And the things that we, in order to understand that system change, that really important thing about what's the context, making sure that everybody that's working in this field has a conversation about the broader context in which these women or these people are living their lives. What are all the connections? And then also the thing about looking for data points. The data points, that you have to look at the thing as a whole process, that actually change takes time. And so the point at which you have to deliver your deliverable or give your data, we need data points, but the data point has got to be part of a bigger story. And then my question about, what does genuine co-creation and collaboration require? That it isn't something that communities are going to do on their own, that we need all of us to work together, recognising all their assets, recognising everything they have, but they're not going to do it on their own. That's what I have to say.
Now if we can welcome